Hi everyone, this is Teresa here, and I will be reviewing a case study in this video discussing an approach on how to treat a surgical patient concerned of the appearance of his everted wound to his right cheek 3 weeks following his Mohs repair. In this slide, you see this is the Mohs defect after margins were clear. Now in this slide, you can see the patient was closed with a complex repair. The setback dermal technique was used for deeps, which creates a moderate amount of eversion. This is my favorite deep suture technique. If you've been following me, you've heard me repeat this many times, but because I've noticed that my patients have healed with less scarring compared to the other standard deep suture techniques, such as the buried vertical mattress and the simple buried. But now the patient follows up 3 weeks later, post-operatively, concerned about the puckering and the raised look noted at the superior apex of the wound. Now, as a dermatology and PPA, here's a question. How would you treat this patient at this stage of his healing process 3 weeks post-op? Would you, 1, recommend scar massage, 2, perform Kenalog injection, 3, perform a surgical intervention, 4, nothing, reassure the patient that eversion can take a couple weeks, months to resolve, and no action necessary at this time, or 5, other. Now, I posted this case study in our private Facebook community, the Surgical Dermatology and PPA community, and mostly everybody chose either option 1, scar massage, or 4, nothing. Just reassure the patient it will resolve and no action necessary. All right, so now here are the tips I wanted to share with you. In this slide, note the gradual improvement from his 3 weeks to 4 weeks post-operative follow-up. It's subtle, but gradual. I always remind the patient, be a patient because with time, the wound will heal. And oh, by the way, scar maturity can occur even after a year. Again, patience is key. So after any dermatologic surgery, setting those patient expectations and expected outcomes will produce a happier, less concerned patient. Having an educated patient always improves adherence to therapy, improved results, less headaches for everyone involved. Informing them that it can take up to a year to heal is crucial. Wound eversion can take weeks to months to resolve. So again, letting them know, setting those expectations. Now, if puckering does persist, that is when intralesional Kenalog injection can be an alternative approach. It's the conservative first-line therapy commonly used post-surgical repair. And the typical concentrations that we see in clinic is 10 to 40 milligrams per cc, given at 4-week intervals, depending on how thick the scar is. I usually wait 3 months post-surgery to allow the patient to heal naturally prior to any Kenalog treatment. However, in my experience, time and scar massage alone often works with no additional treatment necessary. Also, if the patient has a history of hypertrophic scarring or keloid formation, I would then consider treating sooner for prevention. At that point, silicone gel and sheeting can be added for prevention of hypertrophic scarring, and this can be applied daily for 12 to 24 hours for 3 to 6 months once the patients start becoming symptomatic and complaining of symptoms like pruritus, pain, and hypertrophy. If conservative approaches that I've just previously mentioned are not working and time has not improved, it's been about 6 months and more time has continued, that is when surgical intervention would be the last option due to the invasiveness of another procedure. A partial removal using a fusiform excision would be the best technique, excising only the persistent pucker with as narrow a margin as possible, similar to a standing cone revision. So, just to wrap everything up, the take-home points to remember are Educate your patient and set those expectations early. It can take even after a year for scar maturity to occur. Allow the wound to heal naturally on its own. Treat conservatively as needed. Surgical intervention is the last option. Now, if the patient has a history of hypertrophic scarring, keloid formation, you may want to consider earlier treatment for prevention. If you are a dermatology NPPA and you want to learn more topics like this, you can find more information on my website, teresasurgenp.mykajabi.com. Kajabi is the platform where I host my course teaching advanced suturing techniques in future courses for the dermatology NPPA. You will also find more information on that where you can put yourself on the wait list for the course, and you will also be able to join our free community, the Surgical Dermatology NPPA community. Also, in the description box below this video, the links will be there for easy access. I hope to see our community empowered and grow and would love to connect soon. All right, bye for now.